session number 2. So this is just an excellent time for you to be able to bring up any concerns or questions that you might have. And there's a team of us from the CDPH Office of Oral Health on this call right now. So if you have any questions, whether about program work or the application documents or the budgets, you have an excellent team here on the meeting today who hopefully will be able to answer any questions or problems you might be encountering. So again, about our new funding opportunity, all local oral health programs with current contracts are eligible for this opportunity. So just a reminder that this grant is non-competitive. Again, all of our local partners who have current applications and are able, current contracts and complete applications will be considered for the funding awards. So the purchases are to support software and hardware to support community clinical linkage systems and school-based or school-linked programs. Please note that this meeting is intended for those of you who are having issues or might have questions or need assistance with this grant application. So if you're not having any problems, you don't necessarily need to be here today. But if you are having any questions or issues or areas where you need assistance, you're definitely in the right place today. Just a few reminders of Zoom housekeeping items. I don't know if you've noticed, but we are hosting this meeting today through more of a meeting format rather than a strictly webinar format. So please keep yourself muted. But if you do have a question and you want to have a little conversation as we call on you, you'll definitely have the opportunity to unmute yourself as you scroll to the toolbar on the bottom left of your screen. You should be able to toggle mute and unmute. So that's one little difference that we have hosting this as a meeting rather than as a strictly webinar format. And just a reminder that today's session is being recorded. So as we're going through the different sections today, please, if you have any questions that come up in that area of the application, please feel free to type questions you might have into the chat box. And as we're kind of going through different areas of the application, we'll definitely allow some areas to pause and really take some time for some questions and answers. And also a reminder, please try to utilize only one form of audio to avoid feedback. Sometimes it can be a little challenging if you have your phone and your computer microphone on at the same time. Sometimes it can create a little bit of a feedback loop. So just try to be mindful of that. And here's an overview of today's agenda. We're going to start with a check-in poll. So for those of you who have smartphones, please try to have those handy in just a moment. But we'll start with a check-in poll, and hopefully that'll give us a little bit of an understanding of some areas of the application that you might have questions about or be experiencing challenges completing. Then we'll go through different elements of the application. We'll go over the application checklist of the contents of what would be considered a complete application. We'll also talk about some key timelines, important dates, and other reminders that'll help you just stay on top of this application. We also have some sections where we can maybe have some discussion about some frequently asked questions. And then we'll close out with check-in poll number 2. And we're hoping to see that the final check-in, hopefully some of the problems that you've been having, we've addressed them during the question and answer period today. But if we do end up having any questions or challenges after today's office hours session, we want to encourage you to please contact your program consultant and CC the dental director, and we would love to help you out. Again, we're in the final stretch here, so we know it's crunch time, and we would love to help you work out any challenges or any remaining questions that you have after today's session. And here's a little bit of a recap from our first session. From the polls and even just through the questions and answers we received, we really noticed that most attendees were experiencing challenges or questions about really 2 major sections of the application, and that was the scope of work deliverables document and the budget section. questions were added from our first office hour session to our most recent question and answer sheet. So I hope you all have been able to stay up to date with the different iterations that we've been sending out of that Q&A sheet. We've really tried to keep it current. And then after today's meeting, we'll probably do about one more update of that and hopefully get it out to you late this week or early next week. So you kind of have all the most recent information as you near the final portion of your application process. The recording from session 1 is available on the COTAC website, and the recording from today's session 2 will be available for there too if you want to share it with any team members, anybody who wasn't able to join us today. That'll be a great resource for you to pull from. One other thing that we did after our first office hour session was we created a little bit of a revised budget template that we think will help you simplify your budget submissions and hopefully make your life a little bit easier. I know we had a lot of questions about the budget, so we're hoping that this is helpful to you. So again, please pull out your smartphone and go to menti.com. And the code that you want to enter is 49825688. Again, that's menti.com, and I'm going to go ahead and share my screen. And we should be able to see live results of that poll. Let's try to check it out. Give me just one moment, everybody. Here we go. Again, menti.com, www.menti.com. And on your smartphone, the code is 49825688. So far we see some issues with the budget and then a other. We'll give it a few moments. We'll give it just another moment and make sure everybody who wants to vote gets the chance. But we do have a few other questions. And then a little bit different than our first office hour session, we do have a question about the document B grantee information form. So please, whoever has that question, when we get to that portion on today's presentation, please feel free to either type that question in the chat or some other way. Just make sure that we're able to help you out with that, because that was something a little bit different from today's poll than the 2 polls that we had last time. Okay. Well, looks good. Looks like we do have, probably the most questions on the budget revision, and then we do have a few others. So maybe we'll try to get to that portion, past the budget, and hopefully we can allow some space and some time to really have those individual questions that aren't on any of these areas to be able to have that opportunity to ask those questions. So I want to thank you for that. That just really helps us understand which areas of today's presentation we might need to prioritize or spend the most time on. So I really appreciate that. Again, it doesn't look like anybody that we're aware of is having a problem with the application checklist, But just want to remind everybody that this application checklist is a good resource if you get confused about what would be considered a complete application. And again, all we're looking for in a complete application is a application checklist, a grantee information form, the scope of work and deliverables, the budget form, and the governmental payee form. And again, a reminder that application checklist and contents are due Wednesday, April 21st, 2021. So that's just a week from today, folks. Please note also that all the required forms and supplemental information can be accessed on our landing on the COTAC website. And also feel free to reach out to us if you have unable to locate any of the items that are required for the complete application. Here's our document B grantee information form. The purpose of this form is just to obtain information about the organization, grant signatory, project director, and appropriate funding tier. Again, we do have obviously we do have contracts with you, but really having this form helps us make sure that we do have the most recent information. If you do experience issues with signing authority at this stage without board approval, please let us know if you're expecting that to be an issue. One final thing before I hopefully we can get any questions that we have about this sheet is that this very bottom place for the total funding requested. Obviously, we do have funding tiers, and we have broken them down by the amount of funding that each jurisdiction could expect to receive, with the understanding that if we do get some jurisdictions who decline funding, that funding amount would very much be, could expect it to be increased. But for this funding amount, since all the documents that we have had to so far have been optional and non-binding, we can't make any official commitments that you will get more funding as of this moment. So what you would want to do when you're completing this total funding requested would be to reference our funding tiers and find your jurisdiction and just use the baseline funding for here. So again, unfortunately, because all the documents like the letter of intent have not been mandatory up until this point, and they've been non-binding. We can't give you any for sure commitments right now. What I can say is it looks like we have had some jurisdictions who have told us that they might decline. But again, we can't give you an official response just because until we get all of the applications, we really have to just go off of this funding tier, and that's when we'll really be able to provide you with a more official response as far as how much funding your jurisdiction might receive and things of that nature. But it looks good for those of you who are planning on accepting the funding from the information we have available, early information we have available right now. It looks like it very much might be more than expected. So with that, I know we did have a question on document B. Keiko, did anything happen to pop into the chat yet?
Yes, actually, Ryan. There's a question from Sam Monroy. She's asking, in 2020, we submitted an updated taxpayer ID form. Can we submit the same one if information is still correct, or do we need a new one?
Kimberly, would you be able to?
Sure, yeah, this is Kimberly Steele. I'm the Administrative Support Unit Chief, and yes, I don't see any problem with getting that same form back again. As long as everything was accurate, it will help us as we're processing those amendments to have those at hand while we have all the rest of the application together. So yes, I don't see any problem with that.
Great, thank you, Kimberly. And the next question, it's from Nancy Starr. She's asking if she can ask for less money than what the tier states.
Kimberly, would you be able to help with that as well?
Yeah, I don't see why not. Unless somebody else has another comment to make, if you only think that you can spend a certain amount and it would be maybe even a burden to ask for all of it, I don't see any reason why you wouldn't just ask for what you need. It just cannot exceed that at this point, because at this point we won't know how much additional funds there are.
Yeah, and I just want to reiterate that the plan is for if we do end up having some extra funds to be redistributed, we'll use the same funding tiers that we're using now to equitably redistribute it to all of the jurisdictions who are moving forward with their applications.
And that's all the questions for right now, Ryan. Thank you.
Awesome. Thank you. Now, here's an area when we did a Menti poll that we did see some questions on definitely. And this is the scope of work and deliverables, or document F. And the purpose of this form is to track and implement strategies recommended in the California Oral Health Plan. So the deliverables that you see with the objective 6.4 on the column on the left, those are for component 1 in care coordination, the software and hardware to support community clinical linkage systems in school-based and school-linked programs. And so if you're applying for component 1, then you're going to want to check in the column that you see to the very right. You're going to want to check those selected deliverables. And if you are applying for component 2, or for the equipment support, and that supports some of the school-based, school-linked film equipment, dental equipment, if you're applying for that component 2, the equipment support, you would then, for all the deliverables that you see on the far left column, objective 6.5, you would select all of the checkboxes in the column to the far right for selected deliverable. If you are applying for both funding components, what that will look like is on the far right column, you'll end up selecting all of the deliverables. So that's the scope of work in deliverables in document F. So we did have a few individuals who indicated they had some questions about this. So I'd like to open it up right now for that. Did we have any, Keiko?
Yes, there is a question from Danica. She said she's currently working with her team to price quote equipment and care coordination systems. Based on what I'm price quoting, especially for care coordination, I'm seeing prices that are suspiciously inexpensive, but what makes me wonder is for requesting funding, if we apply the full amount in our funding tier, will we be penalized if we end up not using the entire fund? So I think she's asking about the care coordination and equipment purchases.
This is Kimberly, and I'll answer the part of penalizing. There will be no penalty if you're not able to spend the money. We realize this is coming late in the grant. We know you have limited time to do this work and to purchase these things, so there will not be any penalty. But I'll let somebody else, if they have any response to the other part of this question.
Yes, thank you, Kimberly. Hi, everybody. This is Joanna Albo. And just to address some of the concern, we would like you guys to think ahead and keep in mind that the next 5-year cycle that'll start in July of 2022, it will focus on COA and school-based dental programs. So the referral management system will be part of that next 5-year grant cycle. So this one-time funding, is to provide funding to plan for that next cycle, kind of give you a little head start. So if you could think like that and kind of think ahead and plan ahead, hopefully you will be able to, but it is good to know that there would be no penalty if you couldn't spend what you received. I hope that's helpful. Thanks.
Yeah, I think also when people are talking to vendors, they'll see that they might have other services that are provided. Obviously, yeah, we've noticed the same thing in some of the different software options we've worked with that have offered their software as a service, that the licenses for a lot of these different systems we are looking at actually look pretty affordable. But again, that's just the software. And one thing to also consider is some of the people elements around the software. So, you might want to also plan that there might be costs associated with training or consulting or onboarding providers. And when we get a little further along and definitely in that September through December period, I think those are discussions that you might be having with some of the vendors that are providing these software systems. So it does seem like a lot of the systems we've looked at have been surprisingly affordable, but I think you can anticipate some extra costs that would just be associated with all the training, onboarding, consulting, coordination, and things of that nature. But again, as you've heard, if you do have extra money left over, of course, no penalty from that. But again, we encourage you to really use as much of this funding as you can, or try to use all of it to really help further the impact that you're making, and also kind of getting started on some of these elements that'll be foundational in the next 5 years of the work that we're going to be doing together.
And then there's a two-part question. This is from Cherise Browse. She's asking, are you required to check off all of the deliverables? For example, in deliverable 6.5, can you select 5.1 through 5.6 and not check 5.7?
Hi, Sherry. This is Joanna. We really need you to check all of those, and 5.7 is the one about the sealant retention. And again, you'll be working with providers in your community, but they should be doing the sealant retention checks. So hopefully that won't be a big deal, but it's really important in this process that we do follow through and do at least a percentage of the sealant retention checks. It helps to make sure that the materials, in the past, well, there's a variety of reasons for it, but one of them was, maybe the materials wasn't working as well as they thought. When the sealant retentions, wasn't very high, some programs decided to change sealant material, but there's a lot of reasons for it, but we want to make sure that the sealants are staying on and protecting the teeth. And if they're not, what the potential problem could be. So the sealant retention checks are really, really important.
Great, thank you, Joanna. So next question comes from Aisha Sanders. She's asking, we plan to purchase dental chairs, which cost less than $5,000. The budget defines equipment as $5,000 or more. Do we consider them supplies, therefore only working on 6.4 deliverables?
This is Kimberly. I'll answer the first part of this. And so the equipment is for any one item over 5,000. So yes, you would list that under other, but you would in justification, or actually in that line, you could say how many chairs that you're purchasing, and then have the justification clearly state the cost of each of those. And then I'll let somebody else answer that second part, because I'm not sure of that.
I'm sorry, I'm trying to figure out what.
Yeah.
Yeah. What was the second part of that question again, Keiko? Could you reread that?
Sure.
Or maybe even the individual who asked that, if you'd like, you can also just unmute yourself right now.
I can unmute. I was just wondering, because most of 6.5 is about, equipment in the software, do school-based care. So we plan on doing some dental days on the school campuses. So I guess the activities are school-based, but it's not really equipment. Do you want us to select just 6.4?
Yeah, I see what you're saying. Are you going to be purchasing the software from 6.4?
Yes.
Okay. Yeah, I see. Do you see what she's saying, Ryan? It's, if they're going to be using the software and then they're not going to have equipment that's over 5,000, they could add that as supplies from on the template for 6.4 just to keep it simple. Does that work? That works fine, right?
Yeah, is it just the dental chairs they're getting?
Yes, just the dental chairs. Can you repeat your answer one more time? I'm sorry, I was trying to follow it.
Yeah, I know. I was checking with, the team just to see too. But yes, I think if you apply for the first component and you're buying the software, you could add the dental chairs as supplies under that line item. That does make sense. You don't have to apply for both just to get the chairs.
Okay, perfect. Thank you.
Okay.
Do you have any other questions?
Yeah, there's a budget question from Primavera Hernandez. She said, I see the part of the application is to be submitted the fiscal year 21-22 revised budget and justification will include supplemental grant funds. I'm not clear how I can provide accurate information since I do not know how my fiscal 2021 budget is going to finish out at this point.
This is Kimberly. Brian, do we want to go on to the budget area before we answer that one? Do we want to look at the?
Yeah. Let's talk about that when we get over there a little bit. Yeah. Is that it for here, Keiko? For the SOW?
Yes.
Deliverable?
Yes. There's no more further questions.
Let's go move on then. Yeah, that sounds great. So again, we didn't see any questions here, I don't think, on the Menti poll for CDPH 9083 governmental payee form. But like our other form that we went over, we just want to make sure that we have the most recent information for your jurisdiction on file. And a reminder, if you do not have signing authority, please let us know, because we want to make sure that if it's something you need Board of Supervisors approval, that we're able to provide you with a little bit of flexibility about having to get the signature on this form. So again, if your program does not have the authority to sign and you need your board approval, please try to let us know about that.
This is Kimberly. Early on, somebody had asked the question on that form. If they've recently submitted the form and all the information is accurate, it has not changed, can they submit that same form? And I'm okay with that. One of the ideas of having this with the package is so that when we go to do the amendments, we have everything we need at hand and we're not trying to go back and verify that something is accurate. So if you're verifying the information is accurate, there's nothing that changed, you can submit a previously submitted form, but we do want that still as part of the package.
Thanks for that, Kimberly. So those of you who have any questions about the budget, we'll get your chance in just a moment. A reminder that this past week we did send out a revised simplified form. So we're really hoping that helps you all out, and we'll come pull it up on the screen share in just a moment. Just kind of go through a few key reminders here that the funding mechanism of this funding opportunity is actually a contract amendment to your current contract rather than us issue this new funding as a standalone grant. So what we're really looking for here is some line items and cost estimates. I know there might be some confusion over how detailed, or do we include your staffing costs, your admin costs. What we're really looking for here is just the funding that you'll be applying for, and then your planned purchases to use that funding. And those will most likely, unless we've talked to you otherwise, will fall under the equipment or other costs categories. So this is a one-time funding opportunity, and we're not it doesn't cover the cost of salaries or new positions. We've had a few people talk to us, and those jurisdictions might have to do this a little bit differently. But again, most of what we're looking for here should fall under the equipment or other costs. And one thing we touched on a little bit earlier today is that items costing $5,000 or more should be listed, and that's per unit, should be listed individually on the equipment, where smaller purchases and costs that are under $5,000 could be listed under other costs. We do have a couple of vendors that we recommend you can check out their websites for estimates. And I do believe we also have some webinar sessions being scheduled with COTAC and these vendors to tell you a little bit more about their equipment. But these resources might be helpful to you if you're still trying to cost out some of those component to cost estimates. And those are the DNTL and Aseptico. And I'm wondering if one of our partners in COTAC, if we can maybe circle back later and send out the websites to these today, so that folks know where they can find them. Or we can also do that when the Q&A sheet comes out. But again, these are two vendors that we recommend you visiting their website if you need help with your cost estimates. And here is what our new detailed budget that we had sent out this past week looks like. Again, what has really just been removed are some of the personnel and other items that were on here. So this is where you'll add your line items and your cost estimates. And then we have this sheet on the bottom for justifications. So this is a good idea where you can really, if you feel like there's anything that would be helpful for us to know in helping to explain your costs, this is a helpful sheet right here that you can use to kind of give a little bit of description of the costs, and if you're worried about us being confused by anything, or this is a good chance to tell some of your story here. And again, it's how these planned purchases can support the intended purpose of this program. Kimberly, did I miss anything on kind of going over this new revised form that we put out?
No, Ryan, you did great. You know, really what we want to do is just make this simpler for you. We don't want you to have to go do a full revision at this time. You know, obviously this money is going to go into the final year of the grant. Many, if not all of you, will have carry forward funds that you'll have to integrate in. And then once we do that budget revision in September, we will move this into that budget. That'll be requested to move these, you know, whatever was the new funds, add that in along with, so you'll have your final year budget, any carry forward, and then also the funds that for this RFA, and that'll all be integrated into that final year budget. But we can take some questions now too. It looks like some are popping up.
Would you like to go back to Primavera's question about the fiscal 2021 budget?
Yes, could you read it again?
Sure. So her question is that I see that part of the application is to submit the fiscal year 21-22 revised budget and justification that will include the supplemental grant funds. I'm not clear how I can provide accurate information since I do not know how my fiscal year 2021 budget is going to finish out.
Right. Yeah, this is Kimberly again. Yes, that's why after a few questions that we got, we went with this simpler format, because that's right. You're not going to really know. I mean, you could always use your base, but it makes it really confusing, and all counties or jurisdictions may not be at that point yet. So this new template that's been provided, it was sent out in an email. It's also on the COTAC website. This should simplify that so that you're really only itemizing fund, this particular funding, and then justifying those purchases that you plan to make. And how I see it is, your carryover funds or the existing salaries would be in place to help manage these purchases and the work involved in that. Or you can make those adjustments in September when that budget revision is taking place. If you happen to need something sooner, but the funding won't even be in place until later this fall when we're able to get everything back. We have to work on the amendments, get them back to you for signature. So there's going to be that process. But we will allow time for revision later in case you need to make some adjustments. Hope that answers it, but if not, please jump in.
And then this is kind of a follow-up from Primavera. She's also asking, so do we need to submit document C? Or she's asking if this is all she needs to submit is the document C.
Right, yes. This is all. You would not have to submit your 2021 budget at this time. That's part of making this simpler for you. I was thinking it makes it more complicated both on your side of preparing and our side on reviewing. So we're going with the simpler version. So yes, you would only need a document C, and there's 2 tabs. So you'd want to make sure to complete both tabs.
Great, thank you, Kimberly. Going on to the next question. This is from Danica. She's saying that she'll be applying for 2 of the funding, and she's saying that the problem is that she's having some funding for the sealant, or they're having the funding, that they're having some issues with the sealant themselves. Our partners who are doing the screenings right now are unable to provide the sealants because of the reimbursement issues. Knowing that this is a crucial point of the scope of work, and knowing that we may be able to provide one-time purchase of sealants and fluoride varnishes, but ultimately need to find a sustainable source, I'm just concerned about purchasing equipment with the intent to do sealants, but not being able to do so. I was curious on your thoughts.
Some of my thoughts are definitely what we're hoping for now is to establish a starting point in a lot of the process that we have, and it's definitely what we're looking at in the period beginning of September, where we really start ramping up the planning and implementation, is that that will be definitely a part of the process. So some of that may be partnership building, establishing memorandums of understanding. So we're obviously trying to meet each jurisdiction with where they're at in the implementation of their school-based and school-linked programs. And we understand that some people here might be starting from scratch. Some of the other jurisdictions that we're working with have been working in school sealant programs for many years. We are hoping that this can be a start and really kickstart some of the items that we want to see continued in our next 5-year cycle. And it's also helpful to understand that we will be offering support in partnership building and building those memorandums of understanding and helping jurisdictions work out any challenges that they're facing with their partnerships and getting those programs going. So I do believe we have some webinars and other resources that will be available in the summer to support jurisdictions in the partnership building and that process. So if you are experiencing some challenges right now, I wouldn't necessarily let that stop you from applying for some of these startup costs. But again, the idea is that in the period beginning September of this year, and especially in the period from September to December, we are expecting a lot of that planning work and some of that partnership building and other elements to begin to fall into place. So that's not necessarily required this early in the application, but it will be a huge part of this process.
Great, thank you, Ryan. And I think this is another question about software programs. This is coming from Ron Shima. She's asking if there's different software programs lists that they can look into.
Unfortunately, we're still working on that at this moment. Does anybody else on the team have an answer that better than that? I think at the moment we don't.
Not just yet. We're still meeting with a couple potential of the software so that we could find out all the capabilities, and yeah, we're working to put that together.
Great, thank you. And this question comes from Catherine Bourne. She's one of the participants that picked other on the Menti poll. She's saying, we're seeing that our efforts to meet our current scope of work requirements and expansion through this grant are complicated by the fact that schools are comfortable yet with providing dental services at their locations. Many of the schools have some students on campus, but they do not allow many others besides teachers. Our dental partners are still met with many COVID concerns. Are there any plans to provide any sort of green light to schools to allow for dental services on campuses?
Okay, sorry, I'm catching up with this. I was answering a few that I could too. So our dental partners. So I'm trying to find that question in here, Keiko, so I missed the last part that you said. So are there any resources that you could, let's see.
So this was at 12:40. She's asking if there are plans to provide any sort of green light to schools to allow for dental providers to be at school.
Well, that's a good question. I don't know that we have anything in the works specifically for that, unless Rosanna knows something. But you know, we get guidance from CDC pretty consistently, and there hasn't been anything saying not to do this. So I don't know. I mean, I could understand that I understand that the schools are being a little hesitant, but there hasn't been anything to say don't do this. So I guess that makes it harder to come up with something as like a green light. Do you know what I'm saying?
So this is Kate in Tulare, the question asker. So again, we have you know, FQHCs and other providers in the area that have that we work with, and also that, you know, receive funding from other sources for like kinder care type activities, and all of those were halted at the beginning of COVID. And when, you know, they reached out to restart those programs, the schools are really looking to someone to grant them permission. So it's not so much that it's, you know, no one said you can't do it, but they're really hesitant in without
like a letter of support in some way to say, you know, this is safe and it's important and we recommend it.
That's something
good information
along those lines.
Okay.
And we are, you know, I talked to my director about this, and we're going to look into, you know, asking our health officer to come out with something, but it's still, I think something from the state would also be very beneficial.
Okay. Yes, that's good to know. And so I'll make myself a note and talk to Dr. Kumar about it. Thank you so much.
This is Rosanna. Our department's been working with the California Department of Education on their back to school efforts, especially when the governor reopens the state. And we can see if we can provide information that's a need that all the schools would be helpful. So this comes at a very good time that we can put in a suggestion that we would also like to provide recommendations. And I know that we're still waiting to get a definitive response from CDC, because they're right now on a wait and see. But there have been other school-based programs in other states where their states opened up already with schools, and they're back in the classroom. And we can also look at best practices from them and how they were able to get back in the classroom. And some of them did state that it was a challenge, but once they showed up and kept saying why it was so important, that right now they're being viewed as very valuable to the students on campus. So thank you for bringing that to our attention.
Mm-hmm. And Kate, we do have an optimistic timeline, and we are assuming that the vaccine's available now. And again, you heard Rosanna with Governor Newsom's plan to reopen the state, and he's given the date of June 15th potentially. So we are hoping that this is kind of a good point of time to really be able to provide this funding opportunity. And we know that a lot of our partners on the local level have just had some real challenges with school closures and clinic closures, and we totally understand that. We're hoping that this is a good point of time with school closures, and with the understanding it might just be a little bit longer, that it's a really good time to make these purchases and make these investments. And we've been able to outline a timeline in the application documents that we understand it might take a little bit of a while. So we definitely do have more of that, still that planning period for September through December of this year. So, we understand some of the challenges that are being faced at the local level, and different areas having different policies and different approaches to school reopening. So I think what we're hearing from our panel is we want to support you in any way that we can. So we'll follow up with you and see what we can do.
Great. Well, thank you, everyone. So the next question comes from Esmeralda Cantu. She's asking, there was a mention of possibly acquiring matching funds from the federal government. Should our program reach out to you directly regarding this topic, or are there any resources for this that you can share?
Would someone on our team be able to help out with that question?
Yes, it's a very specific program. We're learning to get the matching funds, and the software program that we were considering in the beginning was a type of registry. And so it'd have to be specific to that in order to do the matching funds. And so I think that we're looking more into that to be able to provide us a direct answer. But it's sort of a complicated matter. I don't know, Rosanna could probably explain it the best. But at this time, we'd have to identify the correct software to meet those requirements for the matching funds. So we'll have to have this conversation at a later date, because I don't think most of the software are going to meet the requirements, right, Rosanna?
Yes, and this is Rosanna. I know a lot of you have Title V programs. The MCAH programs locally are funded by Title V, and they use matching dollars. And some of them have a prescribed amount that they can use to match, but you could check with the MCAH director in your county to see if they have used all the match. And if they haven't, you can get in a conversation with them to see how you could apply. With the Title V matching, if you do any outreach to enroll children who are underserved into a Medicaid program, that's eligible, and some services and professional staff are eligible to be matched. So we can get some more information on just a little bit about Title V and how locally they do have matching dollars, but it varies from county to county if they use all their match already. So that would be the challenge.
Great. Thank you, Rosanna. And this is another software question. I guess it's coming from Kavneet Bhatti. She's asking about the referral software and the cost. And I think that's something that the Office of Oral Health team is working on and will come up later on?
Yes, that is correct. And again, I think one of the things we mentioned earlier today and another jurisdiction noted in their question is that we have been, some of the options that we have looked at, we have been pleasantly surprised of the costs that we've looked at so far. But you're absolutely correct there, Keiko, that we'll be able to provide a little bit more detailed information about what costs could be expected as soon as that becomes available. And again, kind of coming back to that previous question too, there are the costs that we would imagine would be associated with paying licenses or subscriptions to a software as a service. But we might also want to expect that there might be training costs and consulting costs or other costs associated with onboarding partners and users and providers. So it's kind of the people elements that are all support the adoption and implementation of a software. So you might expect other costs beyond the initial cost associated with procuring licenses for such a system.
Great, thank you, Ryan. I think there's no question at this time. Thank you.
This is Kimberly. There was a question earlier and I answered it in the chat, but I do want to share it with all. You know, I mentioned earlier, we won't penalize you if you're not able to spend the money. Of course, we want you to, it does prepare you for the next cycle, but we understand if challenges occur and for some reason you're not able to spend all the funding. But we're not going to be able to allow any money from the current grant to move into the next cycle. It would just be too much of a challenge. It would, it's just not going to be something we're going to be able to allow. So I want to just make sure everybody is aware of that.
Yeah, thank you, Kimberly. Well, and if we do have any other questions in the other category, I think we've addressed some of them. But Keiko, please let us know if we have anything else. And I think we're just about done. So again, following the application period, we will be making those contract amendments in summer of 2021. And following shortly after receiving the applications, we'll provide your jurisdiction with amendment documents that are ready for signatures. So that would mean that obviously you'd have to navigate your board of supervisors and internal review processes. And then we'll have to go through some of the regular processes that you have with the regular grant with us, including your regular budget amendment process and your work plan progress reports. So that won't change, and those will now include these added activities and this added funding. And the anticipated award date, again, we have is September 1st. And so that would give us about a September through June 30th, 2022 implementation period for this new funding and these new activities, with the understanding that in the next 5-year cycle that we're looking at, that will begin July 1st, 2022, we'll very much continue this work and continue to sustain these efforts. Some just reminders of the key timelines. Again, the deadline is April 21st for submission. And we've tried to let the jurisdictions try to anticipate some of the review processes that they might have to go through. So again, if you try to let your board of supervisors know as soon as possible if their approval is required for the execution of this amendment. And we'll do our best to review the applications and give you your notice of funding award as soon as possible. Then in the September through December period, again, that's a lot of that planning and initial purchases period. So at that time, we will talk more about the program plan, and we have provided a template with the RFA that'll help you complete that. And we do have an expanded timeline, and you should be able to find that too on the COTAC website. That has a little bit more of an in-depth, detailed view of everything you'll be expected to complete and when those timelines will be. So again, just a reminder to just please let us know if you plan on declining funds. The grant is non-competitive, so we really want to help all of the jurisdictions who are interested in the funding to make it as easy as possible for you to be able to accept that. If you do have questions, please contact your program consultant and CC the dental director inbox. So we're on the final stretch here. You know, we have a due date of a week from today, so please let us know as soon as possible if there's any way that we can support you in helping you know, you round this final stretch and get a complete application in. We do have some frequently asked questions, and we do have a Q&A sheet that we've been trying to put out just about every week. So following today's session, we will be updating that Q&A sheet, and we'll be sending it out again. So please keep your eyes out on your inbox. And also, if you want to find the most recent version of that Q&A sheet, you can always find that on the COTAC website too. So please try to use that. I hope it's been helpful to everybody. We've been making sure that as new questions become available, whether they're via email or through these office hour sessions, we've been trying to capture everything and including it in that sheet. Keiko, did we have any additional questions on kind of other category type things that came in?
Yes, one question came in. This is from Joanne Smith. She's asking, are there any issues with signing a contract with wet signatures versus e-signature?
Hi, this is Kimberly. Actually, you know, our department has been very flexible. I don't anticipate any problems with virtual signatures. They've been used more often. We'll certainly let you know if there's any challenges with that, but we haven't experienced that at this point. So I don't anticipate it being a problem to accept it.
Mm-hmm. Great. And that's all the questions we have right now, Ryan.
Oh, excellent. All right, moving on again. It's the same code, menti.com, MENTI.com on your smartphone with the code 49825688. So this is kind of after today's office hours session. Are you still having any challenges or any questions about any items in the application? Please go ahead and visit menti.com now and use the code 49825688. Okay, so what I'm seeing are some others. So for the 5 of you who voted for the other here, we don't have enough time, I don't think, to answer every single question, but we want to encourage you to, again, send an email to your program consultant and CC the dental director. And we want to make sure, please try to do that as soon as possible, because we'd love to help you out navigate if there's anything we missed, or even if you have some off the wall type of questions. We want to make sure that we help you resolve any challenges you're facing as soon as possible, because we don't have a whole lot of time left for this application. And so, again, this is a great time to maintain progress during school closures and COVID-19 staff redirections and some of the other challenges that you're facing, that the investment now will really help you on further on down the line in our next 5-year grant cycle. we don't need to fully implement until, you know, this is just the kind of starting point. And again, the idea is that this will help give you a head start in some really foundational elements and purchases that'll really pay off over the long run. So we've done our best to streamline the application and incremental planning process. So I hope that's been helpful. And I see some other things in the chat. Were there any last minute questions we might be able to take in the next couple of minutes here that came up?
I think it's more of a comment. Primavera was saying that I won't have much budget nightmares anymore. That's great. And
Yay, glad to hear that.
and then I guess one of the other was from Cherie. She's asking more time to complete the application.
Would someone else be able to jump in and answer that? And let me clarify, Keiko, and the person who asked that can also unmute themselves if they'd like. Are you asking for an extension or of the deadline, or?
Yeah, this is from Cherie. Would you like to unmute yourself? She's saying, no, I should be fine. So.
Okay.
Great.
And I guess that's everything, huh, Keiko?
Yes, and actually, I think maybe we can make an announcement. We're having a webinar, equipment webinar from the vendor Aseptico on May 11th. That's going to be on Tuesday, May 11th at noon to 1 o'clock. We will be going to send a registration and information out in the next upcoming weeks. So if everybody can join, we'll have a great informational session with the Aseptico vendor.
Awesome. Well, I want to thank everybody for joining us today. And again, please contact us via email if there's any other questions you have or anything else we could do to be of support to you. We would love to help you in any way that we can, and we want to do our best to support you and the wonderful work that you do in California's community. So I want to thank you all for joining us today, and thanks for all the engagement and participation today. And thanks for the team on the Office of Oral Health for joining us during these office hour sessions. And also thanks to COTAC for really helping make this all possible. So thanks, everybody.
Have a great day.
Thank you.